Midline is very similar to medial. Midline is another longitudinal, meaning it's this way, measurement that divides the body into left and right halves. It is down through the navel and following the spine. A cranial midline shift. So you have cranial, that's toward the head. Midline is that longitudinal line, and shift means movement to one side or the other. So cranial is referring to the brain inside the skull. It's not the skull that shifts, it's the brain inside the skull. Where the midline of the brain shifts. So instead of having a brain on an image that has two equal hemispheres, the brain is pushed either left or right. And again, that kind of trauma can cause shearing of blood vessels. Those blood vessels rip and blood starts to flow out into the brain under the membranes that cover the brain. So a cranial midline shift is a serious situation. It can also happen when the pressure inside the skull is too high and it pushes the brain one side or the other. Surgical midline approach, and I'm going to have to Google this one before I tell you because I don't want to tell you wrong. If in doubt, check it out. Okay, I'm not even going to go there. I am not a surgeon, don't want to be a surgeon, but this is a type of incision. So that's all I'm going to say. It's a type of incision that follows the midline. Type of surgical incision. A Y incision in an autopsy is not exactly midline, although it is to some extent. If you look at this picture, the Y incision will make, it's going to make this type of incision, and it will run the length of the body, the length of the torso. So this is midline, but this is not exactly midline. That's what I was looking at. I was trying to give you an example. Again, I'm not a surgeon, so I don't know exactly what type of surgery would use that approach, but your surgeon does.